My name is Kristen. I just gave birth to my daughter Stella 2 weeks ago.
My name is Lisa, and my daughter Karen was born 5 months ago.
My name is Genna Campbell, and my son Liam is 8 months old.
The second trimester was easy breezy. I could continue to run. I actually did run a half marathon at 5 months pregnant, so that was like totally cool. And just, regular activity. I had to kind of scale back running towards nearing the third trimester, but nothing overly, no cravings, no extra tiredness like before I had in the first trimester. It was just kind of easygoing.
I would say not a lot of changes. My energy level definitely came back, which is great. I didn't experience any odd cravings or anything, the standard things people experience, but my energy level did come back, which is good.
The second trimester was much better. I mean, you're bigger, but it was easier because everyone knew you were pregnant, so you weren't like keeping that secret anymore. You weren't nearly as tired. You could do a lot of things. The appointments were really easy. There weren't any big, you're not near enough to your labor where you're even really thinking about it. There's no nerves there. So it's kind of like the sweet spot in your pregnancy. And to me, that was easier than before when no one quite really knows if you're pregnant or not. And they're all like afraid to say anything. And it's like awkward in your first trimester. But the second one's nice because then you can talk about and share those things.
My name is Michelle, and I'm a labor and delivery nurse manager. They do a screening for gestational diabetes during the second trimester, and there are some routine screenings that providers do, so of course that's another reason to make sure that you're seeing your provider. Most often, the morning sickness does tend to go away during the second trimester. All women are different, so there are some women that don't experience any morning sickness at all, and there are some women that experience some morning sickness throughout their entire pregnancy. But for the most part, the morning sickness subsides after that first trimester, and women tend to feel much better, both from an energy standpoint. They have more energy during their second trimester, and their appetite usually returns during that second trimester as well.
Beforehand, I did actually go to a breastfeeding class, so that helped as well. It was kind of an evening class that I went to by myself, and they give you a lot of great tips. Thing I learned was right away I wanted to do skin to skin. That kind of helps you connect with the baby, regulates like their heart rate and their breathing, and then you get them to breastfeed within the first couple of hours of life. So I totally did that, and that I think really kind of strengthened my bond with my daughter because I can tell the difference. It's like she's a great nurser and she latches well. So yeah, that really helped. Because then it wasn't all like, what do I do now? How do I nurse? What do I do?
I talked with my midwives a lot. They were wonderful. They're really good at education, at educating patients. They're always took time with me to answer my questions, give me good resources to go to as far as classes that John and I, my husband, could attend. And I took full advantage of all those opportunities because I knew nothing. So any educational pieces, I was just, on top of.
My husband and I went together. We did a full day on a Saturday, and they talked about like Lamaze and your pain options and kind of just basics of how to care for a newborn. So that helped me and him because he'd never been around babies. So.
Childbirth education really helps the parents to be educated about the whole pregnancy and childbirth process. So pregnancy really starts from the beginning, and so just information about being healthy, having a healthy pregnancy, and then towards the end, information about looking for things they should be concerned about in the actual labor and delivery birth process.
I would say it's extremely important because it does, through talking with the instructors and other moms that are there that are experienced, they play videos. It does give you a little bit greater awareness of what to expect and tools and tricks and things to make your labor and delivery a little bit easier.
We do recommend our breastfeeding class for parents that are planning to breastfeed, and that is the healthiest feeding for your child. So being educated about that and making sure that you know what you need to know is recommended, and we offer that as well.